Hi everyone, my name is Pineda and welcome to my Teachback on Chapter 10 Communication Disorders. In this lesson, we'll explore what communication disorders are, how they affect people, and why understanding them helps us build stronger relationships. So let's start with a quick reflection. Think about one time a miscommunication affected you at school, work, or home. How did it make you feel? That short moment of frustration is something people with communication disorders experience daily. Take some time to answer this question, think back, and reflect. Our student learning objectives, by the end of this presentation, you'll be able to explain how life has changed for people with communication disorders since IDEA in 1975. Explain normal communication development and identify major disorders, their causes, and intervention. Before we move on, let's remember our norms. Respect every voice, stay engaged, listen actively, and connect ideas to real life. These norms remind us that communication begins with respect and understanding. Now let's start off with a warm up activity. Try saying this phrase. She sells seashells by the seashore. Now let's try it with holding our tongue. Hee ha, I hee ha. It's hard to be understood, isn't it? That feeling represents that some people experience uh, that what some people experience every day when speaking. Try it out on your own and reflect on some of the questions. How did it make you feel trying to communicate when words couldn't be understood? What thoughts or emotions came up during this experience? How might this brief activity relate to what individuals with communication disorders experience in daily life? And why is it important for teachers, peers, and families to understand these challenges? Now, let's begin. Communication disorders have been recognized for thousands of years. A Greek orator named Demosthenes overcame stuttering by practicing with pebbles in his mouth in front of a mirror. Today, thanks to research and awareness, we view communication challenges with empathy and science rather than stigma. The Individuals with Disabilities Education Act, or IDEA, guarantees students with communication disorders proper assessment and individualized services. This ensures free and appropriate education for every child and promotes early intervention and positive outcomes. Communication isn't just talking, it includes gestures, writing, facial expressions, and tone. Because society depends on clear communication, these disorders can deeply affect behavior, learning, and relationships. Communication is a two-way process between a sender and a receiver. Message can be oral, written, manual, or visual. Each step, sending, receiving, and interpreting, matters and breakdowns can occur at any stage. Breakdowns in communication. A fun example is the game telephone. By the end of the line, the message changes completely. So it begins with the first person relaying a message. By the time it gets to the last person, the message completely changes. That's what happens when communication isn't clear, showing how easily confusion can occur for those with communication difficulties. There are two components of communication: expressive and receptive language. Communication has two key parts. Expressive language is how we share ideas, like speaking or writing. So receptive language is how we understand what others say. When either one of us is weak, communication can break down. It can fail. Um, speech and language, speech versus language. Speech is a physical production of sound, while language gives meaning to those sounds. You can have language without speech, like in sign language, and speech without full language, like in certain brain injuries. So there language focuses on three aspects: form, which rules for sound and sentence structure; content, the meaning behind our words; Use, when, and why we communicate, known as pragmatics. All three must work together for communication to flow smoothly. Speech and language development. Children develop language in predictable stages: crying, cooing, babbling, and first words. By 5 years old, most children use complete sentences. If a child lags far behind, it may be a sign of speech delay or language disorder. Every child develops differently. Health, environment, and family interaction can all affect communication growth. Some differences are normal, but extreme ones may require support or even intervention. A speech delay means the pattern is normal but slower than expected. Causes can include hearing problems, limited language exposure, or developmental conditions. Treatment targets the cause and includes reinforcement, direct instruction, and collaboration between speech language pathologists, teachers, and parents. The goal is to help the child communicate confidently in daily life. Disorders versus delays. A delay follows a normal path but slower, a disorder disrupts normal communication patterns. The five main disorders are language disorder, speech sound disorder, child onset fluency disorder, social communication disorder, and voice and resonance disorder. Um, Language disorder means difficulty understanding or expressing ideas. In schools, this falls under speech or language impairment, also known as SLI in IDEA. It must affect educational performance to qualify for services. Expressive language disorder. These are one of the three main language disorders. So expressive, this involves trouble expressing thoughts. Students may use short phrases, repeat words, or struggle to explain ideas clearly. It often affects writing and class participation. Receptive disorder. This disorder affects comprehension. A child might not follow directions or seem attentive even though they're trying. It can affect both learning and behavior. Mix of both, students have trouble both understanding and producing language. They might use incorrect grammar, avoid conversation, and have limited vocabulary. Another severe language disorder is aphasia. Um, it's caused by brain injury. It can affect speaking, understanding, reading, and writing. Children with developmental aphasia especially struggle to express needs or thoughts. Around 18% of students in special education have speech or language impairments. Most are identified between kindergarten and middle school. Early support leads to the best outcomes. So, causes of language disorders include neurological damage, emotional difficulties, hearing loss, or poor language exposure at home. Every case is unique and requires individualized assessment. Identification and assessment. Parents and teachers play a key role in early detection. Referrals they really come from the teachers, the parents, or other professionals. And it's good that they observe early on. Assessments may include observations, parent interviews, and standardized language tests. Cultural and language differences can be mistaken for disorders. Assessment should always consider a child's language background and cultural context to avoid misdiagnosis. Early intervention is critical. Students may receive an individualized learning plan called an IOP with goals, strategies, and progress checks. Collaboration among parents, teachers, and speech pathologists ensures consistency. So, programs like systematic engaging learning, early literacy, also known as SEAL, help young children learn through play. AAC, or augmentative and alternative communication, includes sign language, picture boards, or speech generating devices that give nonverbal students a voice. So, speech sound disorders, also known as SSD, involve trouble pronouncing words correctly. They affect how easily um, others understand a person. So the SOTA acronym summarizes common speech errors. SOTA stands for substitution, omission, distortion, and addition. Substitution replacing one sound with another, like for example, white or right. Instead of saying right, they say white. Omissions leaving out sounds like lost versus loss. Instead of saying lost with a T, they say lost with no T. Distortions producing an unfamiliar version of a sound. Additions is inserting extra sounds like instead of dog, they say dog with the on the last. Effects of SSD. Speech difficulties can affect confidence, participation, and peer relationships. Many children feel self conscious about their pronunciation. Causes of SSDs, there are three main causes: neurological, like for cerebral palsy or brain injury, and then there's structural, such as cleft palate or dental issues, and then there's functional, which is caused by environment or habit. And then we go into the treatment of SSD. Treatment may include surgery, speech therapy, or corrective exercises. Early intervention is best, of course. Untreated issues may persist into adulthood. So these are such: there's surgical treatments, orthodontic and dental interventions, and then it comes with braces, surgery, or prosthetics. So we're moving on to child onset fluency disorders, also known as stuttering. This disorder disrupts speech flow through repetitions, pauses, or prolongation. It usually starts between ages 2 and 7. Some characteristics: children may avoid speaking or show physical tension like blinking or head movements. This disorder can cause frustration and social anxiety. Some causes: stuttering can be genetic or neurogenic, linked to brain function. It may also result from injury, though environment and stress can worsen it. Speech language pathologists observe speech in different settings to measure severity and emotional impact. Early identification helps prevent negative habits from forming. So therapists include slow and rhythmic speech, breathing control, and positive reinforcement. Counseling and family support also play a big role. Most children involve improve greatly with consistent therapy. Moving into social communication disorder, which is also known as SCD, affects how people use language socially. It impacts eye contact, tone, and understanding of context or humor. Some characteristics are they struggle to start a conversation, interpret emotions, or adjust language to fit different settings. If not autism, but the two, it's not autism, but the two share some overlapping communication challenges. Causes, the exact cause is unclear. Family history, ADHD, or anxiety can increase risk. Diagnosis happens after ruling out um, other developmental conditions. So, the identification: teachers, parents, and speech language pathologists observe a child's social communication skills. Real life interactions give the most accurate assessment. Assessments include standardized tests, interviews, reports, social simulations, natural observations. So, with intervention, therapy focuses on improving social use of language. Social interaction treatments help understand social context, emotions, and nonverbal cues. Um, Involving classmates, siblings, and parents helps children practice and generalize skills across settings. Consistency is key for growth. Strategies include social stories, video modeling, social scripts, and small group practices. So, moving on to the voice and resonance disorder. These involve differences in pitch, tone, or nasality that affect how speech sounds. They can draw attention away from what's being said. Characteristics, common symptoms include hoarseness, breathiness, or speech that sounds stuffy or overly nasal. This may result from physical or functional causes. So there's a hypernasality. Hyper is too much nasal sound. Hyponasality is too little, and then volume issues also occur when voices are consistently too soft or too loud. Um, Voice and resonance disorders are hard to identify because normal voice varies by context. A straw test may help detect nasal airflow issues. So treatment depends on cause, surgery for structural issues, and voice therapy for functional ones. Patients may also learn to use prosthetic devices or alternative communication methods. So, summary communication disorders include difficulties in speech, language, fluency, social use, and voice. Each has a unique cause, but all can be improved with early, consistent support. So, my final takeaway from this is communication disorders remind us that every person's voice matters. With awareness, patience, and early support, we can help students find their own voice and confidence. So going to our main activity, you this is called design your own communication aid. Objective is to encourage creativity, empathy, and understanding by designing a tool or strategy that supports individuals with communication disorders in expressing themselves effectively. So the instructions are: think about the types of communication disorders we covered. Imagine you are a teacher, counselor, speech aid, supporting a student with one of these challenges. Create a communication aid that could help the student express needs, share ideas, or interact confidently with others. You can either draw, sketch your design digitally or on paper, or you can describe your idea in 1 to 2 paragraphs. Some of the examples I have here is on the right, which is a picture symbol chart and board, communication books with pictures and symbols, keyring cards with images and words for on the go communication. Have fun with this, be creative. I'm so excited to see what you guys come up with. So now it's time for assessment. Please complete the assessment on chapter 10 on communication disorders on your own time. You can either click on the link provided or scan the code on the right. Please use your real name. It's a game, so have fun. Answer the questions. I hope you listen to the slides or my presentation, at least read, scan through it. Anyways, have fun. Thank you so much for listening. I hope this presentation helps you understand communication disorders in a new way, not just as challenges, but as opportunities to connect with others through patience, empathy, and understanding. Bye.